Welcome to Bloom Psychology. The following is a short, commute-friendly excerpt from our recent clinical webinar, Is It Time for Testing? To watch the full presentation and download the companion toolkit, check the link in the description below. Let's dive in.
So autistic burnout is caused by the cognitive load of constant masking. It's a state of profound exhaustion that results from the chronic stress caused by living in a world that wasn't designed for you. And it often leads to a significant decline in daily functioning. Symptoms include exhaustion, a decreased interest in things you used to enjoy, a decline in abilities like time management, planning, organization, and self care. Those with autistic burnout often demonstrate heightened sensory sensitivity to things like noise and light that leads to increased irritability and difficulty regulating emotions. Social withdrawal is commonly seen in autistic burnout, as are impairments in memory, decision making, and focus. Given how I've described the symptoms of autistic burnout, it's probably not surprising that individuals with ASD are at an elevated risk for depression and suicidality. Patients with mild ASD often don't show the disruptive behaviors that have become highly associated with ASD. And in fact, patients with mild ASD are often able to do things that decades ago we thought patients with ASD simply couldn't do. And certainly that some people, who don't do the continuing ed to keep up with this still think patients with ASD can't do. So patients with ASD often demonstrate good eye contact. I've had patients share that they count how many seconds they need to maintain eye contact, and then they track when they should resume it. When we think about restricted interests, we often think about esoteric interests, like a 10-year-old who knows every detail about the tanks in World War II, or a 4-year-old who's obsessed with ceiling fans or vacuum cleaners. But some individuals with ASD have restricted interests that look typical for their age and may even help them fit in with their peers, such as a girl who's obsessed with skincare and displays products all over her room, or a boy who can recite sports stats in great detail. Individuals with ASD can certainly have friends, though they often describe their friends and themselves as quirky or weird. When considering symptoms of mild ASD, it really helps to discuss how much effort socializing takes, the impact of changing routines, or how patients respond when they can't engage in their restricted interests. Here are some additional factors to keep in mind when considering mild ASD. While behavioral rigidity is a core feature of ASD, it's frequently masked in structured environments like school and shows up more clearly at home. Many children with mild ASD can read obvious emotions, but struggle to interpret subtle facial expressions, tone of voice, or sarcasm. They may sense something is off without knowing what it means, leading them to ask questions, often repetitively, or seek reassurance. We also see atypical peer preferences. Think younger children, adults, or peers who allow conversation or play to center around specific interests. Many struggle with theory of mind, which is the ability to recognize that others have their own beliefs, feelings, and intentions, thus allowing for perspective taking and empathy. When these patterns are persistent and occur across settings, comprehensive testing helps us understand whether ASD, ADHD, anxiety, social immaturity, or a combination is leading to the challenges that are observed. Having socially acceptable restricted interests is particularly prevalent in girls with ASD. They often work really hard to seem normal socially, copying what their peers do to blend in. The duck metaphor that Dr. Caballero shared earlier very much applies to ASD as well. A girl with ASD may seem to be fitting in with her peers and making friends, but it's taking a lot of effort and coming at a high cost. Girls with ASD may appear socially typical, but they often struggle with interpreting implicit social rules, sustaining friendships, and managing group dynamics. This is especially true as they get older and social dynamics become increasingly complex and nuanced. Because their challenges are less visible, girls with ASD are less likely to be referred for testing, resulting in underdiagnosis or late diagnosis. Masking differences to fit in often causes emotional distress and increases the risk of mental health issues. Many women only receive diagnoses in adolescence or adulthood. That delay in diagnosis has a negative impact on physical health. Living with undiagnosed ASD causes a state of chronic hyperarousal or fight or flight, which causes significant wear and tear on the body. Patients with ASD have higher rates of chronic physical conditions. The most prevalent conditions in youth with ASD are obesity, neurological disorders, anxiety, and ADHD. Adults with ASD are more likely to experience recurring health issues that can significantly impact quality of life, including GI issues like obesity, diabetes, high blood pressure, elevated rates of epilepsy, seizures, migraines, and autoimmune disorders. Sleep disorders are often very prevalent, often due to a low melatonin production.
Thanks for listening. If you found this helpful, you can access the full in-depth webinar and our professional resources at bloompsychologyservices.com. The link is right below in the description.